know if I've seen it snow this bad on West Market Street like 5 years. It's unbelievable right now.
It's definitely a whiteout.
Dr. Joe, you just came in from that. Is it slippery?
It's a little bit slippery, and it is whiteout-like conditions.
Wow.
Perfect definition of a squall. You guys said it right.
What do you have for us today?
Well, just before the last game of the season, everybody dealing with the issues with Odell Beckham, they revealed that since before the season started, Jarvis Landry had an injury that he played with all year, and it's a sacral fracture. And a lot of people really scratching their head, how did he play with a fracture, and what is that? And I wanted to just talk about that is an injury we see occasionally. And the sacrum is a triangular bone at the base of the spine, kind of between the two, back of the hip bone or the pelvis, and it's called the sacrum. Most people know it as the tailbone, although some people call kind of the tailbone only the extension of that bone. But the sacrum, anyway, is a flat bone, and whereas there's padding, muscular padding over either side of the pelvis, there's no padding over the sacrum, so it does get fractured a lot. And on a day like today, back in the old days in our pediatrics, this was one mechanism we see a lot of kids will slip out, land directly on their tailbone and fracture. So our emergency room will have fractures. Older people falling off a ladder, landing directly
slipping on ice
on their tailbone, slipping on ice. We haven't had ice for a while. Today we do. In sports, somebody gets undercut going up for a layup. Somebody, football player tries to jump over somebody, land on the tailbone. It's very stable. So you hear us talk about stable and unstable fractures. Unstable means that if we don't do something to immobilize it, it can move. Stable fractures don't move, and they'll heal real well. So you don't wear a cast or anything for it. And, in fact, you can play, and they said Jarvis Landry did play. One other thing I want to caution is we talk a lot about stress fractures. Because it doesn't show up very much on a plain x-ray, we often get an MRI, and he said on the 27th of December he went in and got an MRI, and they saw the fracture, and they weren't quite sure because he didn't have a good mechanism like one of those falls we talk about. So the other thing is a stress fracture and people working real hard, and you'll see this fracture in the bone. It's stable on both sides. The ligaments are really strong on either side to hold the tailbone, the sacrum to the pelvis, so it heals well. It doesn't need a cast. You can play with it, but it is painful. And so you got to give him props for playing through a painful injury. Sometimes it predisposes to other injuries, and he went on to say his hip started to be a problem and he might have surgery on the hip, but not surgery on the sacrum unless it breaks through all the way. Usually that takes like a motor vehicle accident for it to become an unstable fracture. And the one other thing, some people think that there is a complication if you fracture the tailbone, is that the joint on either side is called the sacroiliac joint, the SI joint. And some people complain after they had that jarring fracture that they get sacroiliac joint pain and they feel snapping or popping sometimes. But the joint doesn't slip out. It's a strong, stable joint. It's just a painful thing. We often give kids kind of what's called a donut pad to sit on the hard seats that they sit on at school, because the first week or two it's really painful, and he played through the season. I mean, I read somewhere that he's been in the league I think 5 or 6 years and not missed a game with injury, and that in this day and age is saying a lot. But this year he played through a painful injury called a sacral fracture, and they're not that uncommon in sports medicine, in children's hospitals, in adult hospitals too. So I just wanted to talk about that injury.
You kind of stole my question, and I'll follow up anyways. Can that type of fracture, because they can be painful, can that spread out to cause you pain in your hips or your back?
People do complain of pain. I'd say more in the back, in my experience of dealing with these, than they do in the hips. Maybe some in the hips. But in reading about it, there are complications, secondary complications that people can have in the hip. And what I'm worrying a little about the way he's talking about the hip is, could he have that hip labrum that we hear a lot? As he said, hey, I may need it operated, I may not. That's a secondary kind of thing. But more so, I've pain in the back. So if ever we do anything else for people, sometimes a back brace that gives them compression around that sacrum, that bone, that tailbone, so can sometimes make people feel better when they have that fracture.
And the other thing, and Joe, we probably have some of our listeners who have slipped from time to time, no matter what they're doing, and they get some pain down there. What if this isn't treated? What if they say, I got some pain, I slipped on my back, but I'll walk my way through? What if this isn't treated?
Well, realistically, I have to tell you, and somebody like Jarvis Landry, it wasn't treated. He played through the season and things. It usually finds a way to heal itself over time anyway. So I hate to say that, but I'm saying that it's typically a stable fracture. It's not one that needs to be pinned or operated on or anything like that. It's not one that needs to wear a cast. Where are you going to wear a cast? It's a pretty stable joint. So probably it's the kind of thing where people say, man, I had a miserable 2 or 3 or 4 weeks, but after that it kind of went away. And maybe somebody gets an x-ray later and they see some healed bone, at the bottom of your low back, and they say, hey, you might have had a tailbone fracture, a sacral fracture at some time. So to be honest, with most stable fractures, they do pretty well, and people can do activities they can tolerate with that first 2, 3, 4 weeks of pain.